Good morning. This is Dr. Aldoori. We're going to talk about subject today is about health financing. Health financing is a core function of the health system that can enable progress toward universal healthcare coverage by improving effective service coverage and financial protection. Today, millions of people do not access the service due to the cost. Many others receive poor quality of service even when they pay out of pocket. Carefully designed and implemented health financing policy can help to address these issues. For example, contracting and payment arrangement can incentivize care coordination and improved quality of care. Sufficient and timely disbursement of funds to provider can help to ensure adequate staffing and medicines to treat the patient. Overview. WHO approach to health financing focuses on core function. The revenue raising source of fund, including government budget, compulsory or voluntary prepaid insurance scheme, direct out-of-pocket payment by user, and external aid. Pooling of funds, the accumulation of prepaid funds on behalf of some or all population. Purchasing the service, the payment or allocation of resources to health service provider. In addition, all countries have policies on which service the population is entitled to, even if not explicitly stated by government. By extension, those services not covered are usually paid for by patient, sometimes called co-payment. The primary healthcare there are key facts about primary health care. Over 1 billion people worldwide are at risk of falling into poverty due to out-of-pocket health spending of 10% or more of their household budget. Scaling up primary health care intervention across the low and middle income countries can save about 60 million lives and increase average life expectancy by 3.7 years by the year 2030. The majority of essential intervention, 90% of universal health coverage, can be delivered using primary health care approach. An estimated 75% of projected health gain from sustainable development goal could be achieved through the primary health care. Achieving target for primary health care require additional investment of around $200 to $328 billion a year for more comprehensive package of health service. Primary health care is a whole of society approach to health that aims at ensuring the highest possible level of health and well-being and their equitable distribution by focusing on people needs and as early as possible along the continuum from health promotion, disease prevention to treatment, rehabilitation, and palliative care, and as close as feasible to people everyday environment. Healthcare entails three interrelated synergistic components, including comprehensive integrated health services that embraces primary care as well as public health goods and function as a central piece. Multi-sectorial policies and action to address upstream and wider determinants of health and engaging and empowering individuals, families, communities for increased social participation and enhanced self-care and self-reliance in health. Primary health care is rooted in a commitment of social justice, equity, solidarity, and participation. It is based on the recognition that the enjoyment of highest attainable standard of health is one of the fundamental rights of every human being without distinction. For universal health care to be truly universal, a shift is needed from health system designed around disease and institution toward a health system designed for people with people. Primary health care requires governments at all levels to underscore the importance of action beyond the health sector in order to pursue a whole government approach to health, including health in all policies. A strong focus on equity and intervention that encompasses the entire life course. Primary health care addresses the broader determinant of health and focuses on the comprehensive interrelated aspect of physical, mental, and social health and well-being. It provides whole person care of health needs throughout the lifespan, not just for a set of specific disease. Primary health care ensures people receive a quality comprehensive care ranging from promotion and prevention to treatment, rehabilitation, and palliative care as close as feasible to people's everyday environment. Why is primary health care so important? Member states have committed to primary health care renewal and implementation as the cornerstone of sustainable health system for universal health care, health system sustainable development goal, and health security. Primary health care provides a pragmatic engine of universal health care, the health-related SDGs, and health security. This commitment has been codified and reiterated in the Declaration of Astana, the accompanying World Health Assembly Resolution 72/2, Global Monitoring Report on Universal Health Care, and the United Nations General Assembly High-Level Declaration on Universal Health Care. The health-related SDGs and health security goals are ambitious but achievable. Progress must be urgently accelerated. Primary health care provides the means to do so. Primary health care is the most inclusive, equitable, cost-effective, and efficient approach to enhance people's physical and mental health as well as social well-being. Evidence of wide-ranging impact of investment in primary health care continues to grow around the world, particularly in times of crisis such as COVID-19 pandemic. Across the world, investment in primary health care improve quality and access, healthcare performance, accountability of health system, and health outcome. While some of these factors are directly related to the health system and access to health services, the evidence is clear that a broad range of factors beyond health services may play a critical role in shaping health and well-being. These include social protection, food system, education, environmental factor, among others. Primary health care is also critical to make health system more resilient to situation of crisis, more proactive in detecting early signs of epidemic, and more prepared to act early in response to surge in demand service. Although the evidence is still evolving, there is widespread recognition that primary health care is the front door of the health system, provides the foundation for strengthening the essential public health functions to confront public health crises as COVID-19. WHO response identified three strategies work to strengthen the primary health care worldwide. Number one, a one-stop mechanism for primary health care implementation support member states tailored to country context and priority. This includes putting in action the operational framework of primary health care, capitalizing on investment opportunities from COVID-19 response, building back better primary health care-based health system during recovery effort. This core function is driven by any builds on existing work and experience from countries and regions from across the world. Second, producing primary healthcare-oriented evidence and innovation with sharper focus on people left behind. This work is based on existing implementation evidence, best practice guidance, implementation solution, expertise from successful countries, literature published to drive innovative solution. Key deliverables include monitoring and measurement guidance to assess primary health care progress in countries, and subsequently global report on primary healthcare progress as well as innovative capacity building effort as part of WHO Academy. Third, promoting primary healthcare renewal through policy leadership, advocacy, and strategic partnership with government, non-governmental organization, civil society organization, developmental partner, UN sister agencies, donors, and other stakeholders at global, regional, or country level. Among other initiatives, this work stream will establish external strategic advisory group on primary healthcare to advise WHO on primary healthcare renewal worldwide. It will create a primary healthcare award for recognizing primary healthcare excellence globally, and it will promote new primary healthcare partnership, collaborative network, incorporating new stakeholders such as young health leader, parliamentarian, and civil society at large. There is community-based health insurance. This scheme, usually voluntary, characterized by community members pooling funds together to offset the cost of healthcare. Despite much hope in this system, evidence suggests that the impact of the community-based healthcare on financial protection and access to needed healthcare are moderate for those enrolled. Most community-based health insurance have low participation level, and the poorest people usually remain excluded. Theory and practice shows that community-based health insurance play a limited role in helping countries move toward universal health care. However, they can have other positive impact, such as community development, the local accountability of healthcare provider. The challenges here, both theory and evidence, suggest that traditional community-based health insurance relying only on voluntary small-scale scheme with little or no subsidization of poor vulnerable group can play a limited role in helping countries to move toward universal health care. Universal healthcare coverage. The community-based health insurance cannot be expected to provide major source of funding or coverage. The absence can, at best, provide only complementary role as part of national health financing strategy toward universal health care. This is partly because people with few needs tend to join on voluntary basis. There is usually little or no subsidization for poor or other vulnerable group. Health service utilization rate of members, however, generally increases after enrollment. The WHO response to this developed a health financing strategy that aims at reducing fragmentation and better pooling, enhance the potential of redistributive capacity with the aim to progress toward universal health coverage. The following institutional design features can be considered critical for move away from small community-based health insurance scheme toward national health financing system. Mandatory coverage to the population. The general government revenue subsidized coverage of vulnerable and poor people. Larger, more diverse pool, for example, by increasing the number of enrolled people, pooling beyond local pool or single national pool, and a strong and explicit role, including incentives of local government authorities in enrollment. One key approach to reforming community-based health insurance is to increase the redistributive capacity of the system. For such a reform to realize its potential, however, it must be set within an overall vision of health financing that aligns pooling with other health financing function. Universal health coverage. The world is off track to make significant progress toward universal health coverage. Sustainable Development Goals target 3.8 by the year 2030. Improvement to health service coverage have stagnated since 2015, and proportion of population that faced catastrophic level of out-of-pocket health spending increased continuously since 2000. The global pattern is consistent across all regions and the majority of countries. Universal healthcare coverage index increased from 45 to 68 between 2000 to 2021. However, recent progress in increasing coverage has slowed compared to pre-2015 gain, rising only 3 index points between 2015 and 2021, and showing no change since 2019. The proportion of population not covered by essential health services decreased by about 15% between 2000 and 2021, with minimal progress made for 2015. This indicates that in 2021, about 4.5 billion people were not covered by essential health services. About 2 billion people are facing financial hardship, including 1 billion experiencing catastrophic out-of-pocket health spending, or 344 million people going deeper into extreme poverty due to health costs. The COVID-19 pandemic further disrupted the essential services in 92% of countries at the height of the pandemic in 2021. In 2022, 84% of countries still reported disruption. To build back better, WHO recommendation is reorient health system using primary healthcare approach. Most 90% of essential universal healthcare intervention can be delivered through primary healthcare approach, potentially saving 60 million lives and increasing coverage global life expectancy by 3.7 years by 2030. The free healthcare policy, sufficient financial resources for government to finance the exempted services are crucial for free health services policy to contribute toward universal health care. The free healthcare policies have gained popularity over the past 10 years, mostly in Western Africa. Free healthcare policy remove formal user fees at the point of service. They can apply for everyone, for all health services, or to selection of specific population group or services. While free healthcare policy may trigger an increase in the use of service, evidence on improved financial protection is mixed. Without proper targeting and monitoring, better of population group will benefit from free healthcare policies more than vulnerable population group. This brings us to the end of our presentation. I hope you enjoy it as much as I enjoy preparing it. This is a very serious issue for the healthcare system worldwide. End of dictation.